Hello guys, this is Brian here with a video. One of my YouTube subscribers had asked me to do a video because she had some questions about plastic surgery. She has been approved to have a appendectomy as well as a tummy tuck and hernia repair, I believe. Her name is Regina, and she just had some questions and wanted to know if I was happy with the results I had and things like that. I believe she is located in Texas, because I think she did tell me she has a Blue Cross Blue Shield. So hopefully this helps anybody out there. Now, if you do have Blue Cross Blue Shield Texas, what I would recommend to do is, before you step foot in the hospital, make sure you have that letter in hand before you let them touch you, and make sure it does read correctly, and make sure it does read you've been approved. So they can't come back and say, "Oh, we didn't approve you," so on and so on. Just keep it. Keep the record, a letter for your records. I'll keep it for a couple of years actually, to be on the safe side, and make sure it's clear enough. It says that, because nowadays insurance companies, they're going to try to wriggle out of paying something, even though it's in writing, all because of Obamacare. As well, what's going to happen with Blue Cross Blue Shield, I just don't know. It's their system that does this, or their systems don't talk to each other. What's going to happen when the doctor and hospital files the claim, it's going to be denied automatically. So you're going to have to call them, spend time on the phone, and they will fix it. The plastic surgeon told me that was going to happen, and it did happen to me twice. So I just don't know. It's because it's category under plastic surgery, and it gets denied automatically. You have to call them and tell them, "Hey, I got to prove a letter with the date and case number and so on and so on." So hopefully you don't have to go through that, but if you do, just call them and tell them, and they should fix it immediately. It shouldn't be a major headache, but it will happen, because it did happen twice with me, and my doctor's office did tell me that it does happen majority of the time with Blue Cross. Like I said, I'm assuming that because it's plastic surgery or reconstructive surgery, it's something in their system that automatically denies claims, and they have to override it manually for some odd reason. So I guess the systems don't talk to each other. I was very happy with the results I had from my plastic surgeon. I actually had 2 different procedures done 2 different times. At first I had the appendectomy, and then later on I had a thigh lift. I did kind of plan of having a thigh lift if it was approved later on, but I kind of knew going into the thigh lift that chances were going to be slim that the insurance company was going to pay for that. I knew that I was a shoe-in for the appendectomy for sure, because I had a lot of medical documentation and things like that. And she also asked me if I had anything to change. Yeah, there'd be a couple things if I was able to change them. On both procedures, I wish I could have waited a little bit longer to lose a little bit more weight before I had it done. But all because of Obamacare, because I had my appendectomy back in 2013 towards the end of the year, I think around November if I remember correctly. Sometime last 4 or 5 months of the year, my employer did tell us that we were not going to have health insurance going into 2014, and that was the first year of Obamacare. They claimed that their premiums were going to be so high they just couldn't afford it. So I was underneath a group plan then. So I wish I just could have waited a little bit, maybe another year, to lose a little bit more weight before I had it done. Because I was worried about Obamacare getting kicked in and getting on the individual plan that may not cover the procedure. Usually, sometimes group plans do cover more things than an individual plan. Sometimes group plans have a different appeal process versus individual, because it's governed a little bit different under URSA. And I can't exactly remember what URSA really stands for. Employee retirement, so something to that effect, and it kind of governs a little bit different from the individual plan because it's under an employer-sponsored plan. And so, I was kind of worried about going into switching from a group to an individual plan that, hey, it may not be covered, so I might as well pull the trigger on this now and get it done. But I was very, very happy with the results. You want to make sure you go to a doctor that you are very comfortable with. He's going to see you naked, to do the procedure, obviously, but you do have to feel comfortable. When I went to see him, the plastic surgeon, the very first time, I had a different mindset. My mindset when I went was I was not going to fit into the office. I thought I was going to see people in there that was just getting plastic surgery, like boob jobs, butt jobs, facelifts, and things like that. Which, there's nothing wrong with that. If you want to improve your appearance, you should do that. But I thought that's the type of people that I was going to see in the waiting room. And it wasn't. And the people I did see, of course, I saw those type of people, but I also saw people that needed reconstructive surgery after severe injuries, cancer, and things like that, because my doctor did reconstructive surgery. And plus, I think there was like 8 other doctors in the practice. So, I did go in there thinking that I'm gonna be the odd person out here, and it wasn't like that at all. Now, of course, there was some superficial people there. I mean, it is a plastic surgeon's office after all. I did see some young people in there. They had to be in their early 20s, getting, Botox and things like that. But other than that, I did feel comfortable after I got in there for a little while. I'm going to say this, and I don't know if anyone else experienced this particular problem. I certainly did on my both procedures. It's right after you have it done, it's going to be head games. Meaning that there's going to be some psychological games going on after the procedure when you get home. Not immediately, maybe a couple days afterwards when you get home. Because a lot of things are going to go through your mind, and it's going to be real emotional, almost. And I think what it really has to do with, first of all, is all the drugs that the doctor puts you on. I mean, obviously, you're going to be, you're going to be on some heavy-duty narcotics. I mean, some codeine, Vicodin, Norco, whatever. Plus, you're going to be on some muscle relaxers if the doctor gives you that. And then nausea medicine. So, that alone kind of throws a hitch in things. And then it sets in, oh my God, why did I let the doctor do this to me? Because, it's going to hurt afterwards. Surgeries hurt afterwards. And of course, you're going to get cranky because, you can't move around very easy at all. And you're going to get cranky with your family. I would recommend having a family member help you. If with that type of procedure. I'm assuming. I believe they do use drain tubes for all appendectomies. I'm assuming I had 3 drain tubes with mine. So looking at that, you wake up in the hospital bed. Yeah, you drugged up, but you get home and really seeing tubes coming out of you. It really starts to play games with you, it kind of freaks you out, freaks you out at first. It's just really a mixture of things. Being drugged up, seeing tubes coming out of you, not able to move around, not able to do things for yourself, being in a lot of pain. It's just not going to be a fun time afterwards. That's what I'm really trying to say. But it does kind of, I just don't know if anyone else had experienced that. You just go through a period, maybe a week or two, that you have buyer's remorse, because obviously you're gonna be in a lot of pain. People don't realize pain pills just don't take all the pain away. Obviously, nothing does. But you will have you either have days or nights that you can't sleep, that you're in a lot of pain. You can't get comfortable in the chair or laying down. You feel like you're in hell. But it does get better. And like I said, I just don't know if anyone else experienced that type of situation. I did. Actually, I experienced it when I had my gastric bypass. I experienced it when I had my 2 procedures done. Like I said, it's just you being drugged up with drugs. You can't get around very easy. And you see tubes coming out of you, and it's just not a fun time. You can't go anywhere really. Get in the car and go somewhere. So, and like I said, it does. I think I had that type of feeling maybe a week or two, and it passed. But the end result, you will really, really grateful you did have that type of procedure done at the very end. With my appendectomy, it didn't really, physically I did, of course, obviously, skin been removed, obviously, but it kind of didn't sink in maybe 6 months to a year. That's when I actually really, really saw the results. Because with the appendectomy, with any kind of surgery that's removing skin, you're gonna be swollen for a long time, pretty much 6 months to a year. And of course, another thing that also plays in your psychological games in your mind is the scar you see. You see the big scar. You see the big scar. I'm like, you will think to yourself, "Oh my God, it's never going to heal up," but it does. With my appendectomy, it was from hip to hip, so it is a long ass scar. And also you see bandages. I'm not trying to freak anybody out, but I'm just trying to say is that it's going to play it's going to play head games with you. But you at the very end, you'll be glad you had it done. Just when the doctor finally does remove the bandages, and there's going to be a scar there for a while. Don't rush it. Don't think it's not going to go away. And it will go away. The scar will fade away by time. You just have to take it one day at a time. But like I said, I would recommend having a family member to help you. With my particular surgeon, the reason why you have drain tubes is because get rid of the fluid that's inside your body when they do that type of surgery. And my surgery required me to call the doctor's office every single day, except the weekend, to measure the drainage of the tubes. And that's kind of what they determine when to remove them. With mine, I was able to remove 2 of them by a week and a half, maybe 2 weeks, but the third one had to stay because it was drained a little bit more. And there'd be little pieces of fatty tissue in there, so you don't get freaked out about that. Tissue, there'll be blood, clear liquid. And, some people may not be able to handle that. I was okay with it. That really didn't scare me to death for seeing blood. at all. And those drain tubes will kind of leak around the incision where they insert them at. Now, with me, the third drain tube, like after 2.5 weeks to 3 weeks, it was starting to push out on its own because my body was starting to reject it. And it kind of pushed out halfway, and it started to hurt. Because what they do is they kind of tie it with a stitch, like stitches to your skin, so it don't come out completely. But mine broke off and it started to hurt. So I called the doctor's office, or doctor himself at 9 o'clock at night, and told him, "Hey, this is starting to hurt." He said, I can meet you at the office, or if you want to pull it out, pull it out. It's just gonna hurt for a couple minutes. That's it." And it just hurt for 5 minutes, and that was it. And then after they are removed, the area with the little hole where the drain tube was, it's gonna leak for a while. Before it completely heals up with fluid, especially at night. So don't get freaked out over that. With my surgeon, because there was bandages in place for good 3 weeks. Yeah, I would say maybe 3 weeks. I could not take a complete bath. I had to sponge bathe myself. Now, of course, I was able to put my feet in a bathtub and things like that. But with the stitches, with the incision, I just couldn't submerge myself with a whole bunch of water. So what I did is I had went to Dollar Tree and bought little 2 buckets, one for the soapy water and one for the clear water, and I did it that way. So, you just have to find what works for you about that. Now, with my thigh lift, once again, I wish I was able to wait for a little bit longer to have that done. Well, because another hitch in Obamacare, Blue Cross Blue Shield announced back in end of 2015 that on the individual market they were going to be terminating all PPOs and give everybody on an HMO plan, which what has happened now. And I thought, well, the way things are going, I bet you $5 that the HMO will not cover a thigh lift. So I went ahead and pulled the trigger and have that, went to the doctor about 3 or 4 months before the end of the year, and thank God it worked out perfect. I did have to appeal the thigh lift. It was denied originally, but I did have to file an appeal with Blue Cross, and once it went through another review, they did cover it. Now, with my appendectomy, they did approve it immediately. Like I said, I think it's because I was on a group plan, which allowed more flexibility on benefits versus an individual plan. Now, with my appendectomy, I was in the hospital for either 2 to 3 days and then went home. With my thigh lift, it was outpatient. Maybe I could have stayed a day. But of course, that's what the insurance company tells the doctor. Now, with my thigh lift, I was not able to get around very easy, walking very much. Simply because they put so much medical tape on me, I couldn't bend my legs very well because they taped it going past my knee. But I'm very happy with the results because I used him twice. He made me feel very comfortable. He answered any questions I had. He gave me his cell phone number. Made me feel very, very comfortable, and his office did too. They didn't treat me like a number. Some of these doctors' offices nowadays, they treat you like a number in cattle. Herd you like cattle, but not like that. My experience at the surgeon's office. What else can I tell you? like I said, I'm very happy with the results I had, and you just make sure you do choose a doctor that you're very comfortable with, and you do have good expectations. The doctor should say, what kind of expectations do you have for this procedure, and the doctor should tell you what expectations that he has. On one hand, you don't want to, you can't expect, complete miracle. By the other hand, you do want, you want good results. I mean, I didn't go in there expecting a six-pack afterwards. You know what I'm saying? But I did expect him to, slice off some good portion of skin. I told him not to be chintzy, but I didn't go in there expecting a six-pack and all these muscles gonna be showing up afterwards and things like that. Just be realistic. Just know that right afterwards there's gonna be some head games and it's just, I don't know, just if it just was me or other people experience the same problem. It's just because you're gonna be on some drugs. You can't get around very easy. You're gonna get cranky with everybody. You just gonna have mixed emotions after those type of procedures, or any surgery I ever had. I was cranky afterwards. But other than that, just have good positive thinking going into this. Because ultimately, at the very end, you will be very thankful and grateful that you did have the opportunity to have that kind of procedure. Because some people may not have insurance, or do have insurance and will not cover those type of procedures. So you gotta look at that way too. And like I said, I highly recommend having a family member to help you. And also, you can go to like a medical supply store, or maybe at Walmart. I think they carry these now. Little grabbers that you can pick things up on the floor without bending, like what handicapped people use, or people with back problems. Get one or two of those to help you. What else? And do not skip dosages of pain pills, because if you go too long without it, you're gonna start hurting really bad. And at first, obviously, and don't forget to take them at bedtime, because if you forget, I have done that once or twice, and I learned my lesson. If you forget to take them when you go to bed, you're going to hurt really bad at night. Really, really bad. And also, don't forget to take them before you go to the bathroom, or really take or if you're going to sponge bathe yourself, don't forget to take do that. Because, you're going to be moving a little bit. And do not forget to take them when you go into the car. Especially when you're going to have, when they pull the drain tubes out, or whatever, when you go to the post-op visit. Now, if I was smart enough when I had my appendectomy, I should have used a walker, because I did have a little bit hard time getting around, but I certainly did use a walker on my thigh lift, because like I said, they taped up my legs with so much medical tape, couldn't really bend them very well. But I think you're gonna like the result at the very end. I think you're going to I think you're going to be glad you did have that type of procedure done. And just, like I said, I'm just keep repeating myself. Just make sure you're comfortable with your doctor. If for some odd reason, if you just have something in your gut that tells you that you're not going to be happy afterwards, don't don't have it done with that particular doctor. Because I have read that online that some people, when I was researching I really don't know what's the difference between plastic surgery or reconstructive surgery. I don't know if it's just the terminology that the insurance company uses or the terminology that the doctor uses. To me, since I'm not an expert, to me, reconstructive surgery is for something like after a severe injury or illness, weight loss. Plastic surgery to me is like facelifts. I don't know. I could be completely wrong on the terminology, but when I was researching that, do my appendectomy, a lot of people said if you just have a bad gut feeling, any kind of gut feeling, that you're not going to be happy afterwards, that do not use that doctor, because that mindset will carry over. Meaning, if you did have it done, most likely you're going to regret it. The advice I can give people is, if you go to a consultation and maybe afterwards, or maybe 5 days down the road, and if you just have something in your gut, or maybe in the back of your mind, wherever minute it is, and you think you're not going to be happy, don't have it done with that doctor's office. It could be as simple as you think they're not going to return your phone call in a timely manner. Or it could be a simple thing as the office is a little bit disorganized about calling people or getting things done, or a little bit delayed getting your prescriptions. Anything like that, like I said, don't use that particular doctor, because you may not like the results afterwards. Even though it turned out perfectly fine, it's something in the back of your head that if you don't like, if something tells you something wrong in your gut, chances are you're just not going to be happy. So that's another thing. The best thing I could tell people: you got to be comfortable with that type of a doctor, because some people may also have plastic surgery or reconstructive surgery that not necessarily that you can physically see. Sometimes it's kind of done for people to see in their mind. I don't know what you really will call that. Some people might have like a little nip of tucks, and it makes them feel better. Not necessarily you can see physically, but it makes them feel better. Sometimes people have it done because of that as well. And before I even started researching plastic surgery, I have thought that people who had it done was phony, I guess. I don't know. I always thought that people who had that stuff done had no time on their hands, and in reality, there's really nothing wrong with them. But, I understand it now. Since I had it done myself, I understand why people have it done. And now I think, there's nothing wrong with people having facelifts, butt lifts, whatever you want to have done. If it makes you feel better, I think you should have it done. Or if you want to have it, if you want to do it for looks, go ahead. I don't see any problem with that. It's your body. You have the right to do what you want to do with it. But before I did research on that, I didn't think like that before. I always thought, well, that's kind of vain, or what the case may be. But now, since I had surgery myself, I think anybody should be, if you want, if you think it benefits you emotionally or physically, I don't care. more power to you, and I think people should have that done. Now, but also saying on the other hand, there is some wrong reasons having plastic surgery, and I'm not an expert in that. Obviously, that's something that's between the doctor and the patient. For example, somebody who has too much plastic surgery on the same part, like the nose or something, there's so much the doctor can do. For instance, Michael Jackson. There's only so much that the doctor could do, and if the doctor also feels if doing too much surgery on that particular part of the body over and over and over puts the person's health in jeopardy, that is a wrong reason not to have it. Shouldn't be having many surgeries on that type of body part. When it crosses over jeopardizing somebody's health and life, that's when somebody should stop. But I'm not really expert on that, obviously, and I just wanted to mention that a little bit. There's good reasons to have plastic surgery, and there's bad reasons to have it done, and that's ultimately up to the individual patient and up to the healthcare provider to make those kind of decisions. Obviously, people with common sense, and if the doctor's telling you, if we keep doing surgery, it's going to jeopardize your health, and you ultimately would not be happy. There's only so much things they could do, on the same body part, just like Michael Jackson. There was almost no nose left, and there is some doctors out there that don't care what's going to be the end result. They don't care about the patient. It was all, about the dollar, the bottom line of making a dollar. So, and that comes back to that gut feeling. If you just have a gut feeling that that doctor is just doing a procedure to make him money and not really doing the procedure to benefit you, I believe in my heart that if you ignore that gut feeling, you may not be happy with that doctor. You're not going to be happy with the end result. And that end result may be the only time. I mean, you only have that one chance to have that type of procedure done. So, I think you're going to like it. I think you're going to be glad you have it done. You're going to have this done. If you do have any questions, please, email me or post a comment below. If anyone also wants to ask questions, or if anyone wants me to go into more detail about this, and also another thing I would recommend people to do a lot of research in what you're going to have done, and just don't dive into it. It's not like having a simple operation to have a gallbladder removed. It's a surgery that's involving either your physical looks, your body function of your body. So you want the mindset of being very comfortable with that doctor. You want to be very, very comfortable. Like I said, going back to that, if you're not, I can guarantee you're not going to be happy at the very end. And then the insurance company is going to say, well, you had it done once, we're not going to pay for it again. So, always, if anyone ever asks me, I always tell people, just do their homework, do the homework on the doctor, just make sure you feel comfortable. And if you want to go, if you need to have more than one consultation, go back and have another one. And sit down with the doctor and talk some more. My doctor told me if I need to have that done, to come back and ask more questions. So, that's pretty much I think I have to say. I mean, like I said, if anyone wants to know any more information or anything like that, or more details, please feel free to post below, and I'd be happy to answer. And hopefully this helps anybody. This doesn't necessarily have to be helpful with people that's looking for plastic surgery after weight loss. Hopefully this helps with anybody who's looking to have any kind of plastic surgery to be done. Like I said, I believe if it's going to make you feel better, in your own mind, or not necessarily physically, or if you are doing it for a physical looks, I think it's a wonderful thing to have done. I believe people have a right to do what they want to do to their body. It's your body, you own it. Just to make sure, just always make sure that you do have a good doctor that's behind you, because you do want the best results for you. Now, obviously, if the doctor, you go in to have something like a nose job and he cuts off your hand, obviously, yeah, you should sue the hell out of him. Obviously. And, also tell the doctor what's on your mind. You gotta be honest, especially going to having plastic surgery or reconstructive surgery. You just got to tell him, what your expectations are. Obviously don't be unrealistic. Like for instance, like me having a appendectomy done and expect a 6-pack abs 3 months later. Obviously you can't do that, but obviously go in there with some expectations. So the doctor can let you know, hey, yes, this is a realistic expectation that we can achieve, or no, it's not. Maybe we have to postpone your surgery before you lose a little bit more weight, or whatever the case may be, to optimize the best results for that particular individual. Because it's not like you have to have a gallbladder out immediately because you have gallbladder pains. This, a cosmetic procedure, it involves more things, because the result of the outcome. Well, I guess I better jump off because the battery's fixed to go dead on my phone. But like I said, if anyone, I keep repeating myself because I'm so tired, but if anyone wants to ask me any questions about this, please feel free to post below, or if you just want email privately stuff on YouTube, please feel free, and I will give you my contact information. So if you have any questions or comments, please post them below, and good luck, Gina.